Assalamu alaikum. Communication between patients, relatives, and healthcare staff during the coronavirus pandemic. As the corona pandemic hits and more sick patients go to hospital, less people will be allowed to visit. This is to protect people from catching or passing on the virus. If the situation gets very severe, all visiting into hospitals may be stopped at short notice, even if the patient is very ill and close to the end of their life. In addition to this, healthcare staff will be extremely busy and will not be able to spend a lot of time talking to each patient and involving lots of different family members in discussions. For this reason, it is vital to think and discuss certain things ahead of time, as difficult as it may be. Here is some advice about improving communication between patients, family members, and healthcare staff. If a person gets sick enough to be admitted to the hospital, please think about sending them with a labelled mobile phone and charger so that family members can talk to them over the phone or video call, especially if they cannot speak English. Please also send an up-to-date written list of medicines that the person is taking. Pick one person in the family who talks to all hospital staff, again to reduce confusion. If your family member gets very unwell in hospital, their health could go downhill rapidly, and staff will try to let you know, but they may have to tell you some difficult news over the phone. Please make a plan and let healthcare staff know what would be important for your loved one if they were in the last hours or days of life and the family were not able to be there. This may be playing Quran in the room, asking the hospital imam to visit, or something else. If your local hospital has a Muslim chaplain or imam, you could see if you could speak to them beforehand. Finally, it is important for families to discuss what would be important if a person were to get sick. There is no cure for the virus, but fit and healthy people are more likely to recover with the support hospitals can offer than someone who is otherwise weak. If a person is generally unwell and frail, would they wish to go to the hospital if they became sick, even if it meant that in their last days they did not have their family around them? If they wish to stay at home, please speak to your GP so that they can provide support and advice. In the end, we would do well to remember the example set by our beloved Prophet, peace and blessings be upon him, and his manner of courtesy and good character, even when reacting in the times of most intense grief and distress, as exemplified at the passing away of his son Ibrahim. He said, "The eyes are shedding tears and the heart is grieved, and we will not say except what pleases our Lord." We ask Allah subhanahu wa ta'ala to protect us all in this difficult time.